Hello, everyone, and welcome to the Doctor on Demand webinar, Rapid Response to an Evolving Health Crisis. My name is Bill Karpowitz. I'll be your moderator today, leading you through the questions near the end of the webinar. I do want to let you know that we will be answering some questions. We're leaving time at the presentation. You can use your question feature for that inside of the webinar control panel. I just want to, just get this started right away and head this off to the speaker, Dr. Ian Tong. He's our Chief Medical Officer at Doctor on Demand, board certified in internal medicine, fellow of the American College of Physicians, and an adjunct professor over at Stanford. Dr. Tong, welcome.
Thanks, Bill. Thanks for having me. And I want to thank everyone who has joined for this webinar. We're doing these really to help our members and our patients and our enterprise clients really deal with this unprecedented time, the fact that we are in the middle of a global pandemic with a novel virus of the coronavirus, and just seeing rapid spread of that virus. But we are also in the middle of an infodemic, which is a great deal of information going around, some of it accurate, some of it not. And so our feeling was that we needed to provide people a place where they could get accurate information. And as Bill said, this is rapidly evolving. And so we have changed this presentation numerous times. Almost every other presentation we have done has been slightly different as a result of the evolving nature of this. So the goal is to give you, though, good information and then also point you to some places where you can get additional background information that's accurate. We do want to address people's anxieties and fears. It's very difficult and uncertain to be in this situation. And so we want people to know who's at risk, what they should do if they get sick at home, and then also what healthcare resources are available to them and how they can use the healthcare system effectively. And then also what we've been told, the best part of these webinars is the individual Q&A. And so although I do not have a doctor-patient relationship with any of you and cannot provide any treatment, Bill can ask me questions that you all pose, and then I can hypothetically respond back to him about what I would suggest or what I would recommend. And so that's just one way we want to be helpful to you. We want to help you have a little bit more certainty around what to do here. And we are recording this session, so if you're not okay with that part, probably a good time to jump off, because we'll want to be able to allow other people to view this if they weren't able to attend today. So showing you just now what just some of the situation that's going on. We wanted you all to know where you can find accurate and up-to-date information. We're keeping up to date on our Doctor on Demand site. We have a set of frequently asked questions that you can draw on, and you can scroll through that, find your question, and so use that information if your question matches one of the ones that's there. The CDC actually has a wonderful site with a lot of background information, and they have done a fantastic job keeping that up to date. And we at Doctor on Demand are using a lot of that information again to make sure that what we are saying and communicating is consistent with the latest evidence. And then also what we're showing you here on the screen right now is the Johns Hopkins heat map, which really identifies the hotbed areas. And as if any of you have tuned in earlier to any one of these webinars, you know that this map is getting more and more red. And so the important part is that the pace of that red may be slowing down. And also this number that you're seeing here highlighted in the red circle, we're seeing that a great deal of people, a high percentage of people, are actually achieving full recovery from COVID-19 infection. So those confirmed cases, absolutely, they're going up, but patients are doing better, and so we know that we will get through this. We've been telling people how the virus is spread, and so still it appears to be spread by respiratory droplets. There has been some controversy around whether this is an airborne illness. An airborne illness can float in the air for longer, can stay there for many hours, such as measles, and can travel even greater distances than 6 feet. But these respiratory droplets are of a size and weight that gravity actually pulls them down to the ground within 6 feet. And so this is why social distancing is actually an effective mechanism for slowing the spread. And many of you probably know now that many states and regions are actually calling on people who are going out to wear masks when they do. That's a new development very recently, and as of tomorrow in the state of California, they're going to be requiring masks if you go to a supermarket and so on. Again, so you can block these droplets from making their way into another person's mouth, nose, or eyes, because that is how the infection is spread. Also, these droplets can drop on surfaces, tabletops, and so on. And so if you're around someone who has been sick, whether you know whether they have COVID-19 or not, please do wipe down those surfaces. The most common symptoms that we are seeing still with this infection really are fever and dry cough. But also patients are seeing a lot of fatigue and sputum. The fever and dry cough are happening about 90% of the time with fever, 70% of patients have dry cough. That dry cough is different than a cough that's producing a great deal of sputum. And so that's one thing that's different from a typical cold. Often you all know when you have a cold, you may have congestion and runny nose and postnasal drip down the back of the throat, and that gives you this more wet cough that's productive. That's not been the common case with this illness, so that may be one hallmark that you're able to realize whether or not you might have a presumed COVID-19 infection. There's other less frequent symptoms of this infection. They range in severity from muscle aches and sore throat and headaches and that nasal congestion that I mentioned. But the most concerning symptom that I would advise you to look out for is really irritation of your chest and shortness of breath. So this shortness of breath is a really important symptom to pay attention to, especially if you're a vulnerable, part of a vulnerable patient population based on age or pre-existing chronic illness. But it's the patients who have developed the shortness of breath that are the ones who we're finding that are landing in the hospital and they're needing more support in the intensive care units within that hospital. And so it's really important that you talk to a doctor if you're experiencing some of that irritation in your chest. Other less frequent symptoms are there is some conjunctivitis that people are seeing, so pink eye, and also loss of smell or taste. And so that's another couple of unusual hallmarks of this illness, although those are far less frequent. If we go to the next slide, we are following these confirmed cases. And so we're just showing you a snapshot here. This is obviously going to change, and we will keep this up to date as we move forward with these webinars. But really, New York being a hotbed area along the Northeast there, but multiple cities, New Orleans, here in the Bay Area, Santa Clara County, also Southern California. So many areas are seeing increased numbers of confirmed cases. And so we're seeing also allocation of healthcare resources to the places where we're seeing these confirmed cases pop up. So we've been talking about the social distancing, and some of the good news is actually we're really starting to see this come into play now with the flattening of this curve. So I will just say a couple things about this. One, that gray, darker, tall, peaked curve is really the trajectory that we saw Spain and Italy on, and much of the United States has been on that curve as well. The social distancing recommendations, again, now with the wearing of masks, keeping a distance and avoiding congregating in large groups, has all of that is in an effort to delay the peak, so slow the peak of the illness, and also hopefully a reduction in the number of people who actually get that severe illness at any given time. So we're trying to reduce the peak and delay it if we can, and that delay is what allows us to have available inpatient beds and ICU beds and ventilators or respirators so that the sickest patients do have those beds available to them and those resources available to them. If everyone gets sick at once, we will not have the capacity to put them all on a ventilator at the same time. And so we're really asking people to continue to enforce these strict measures of isolation and social distancing so that we slow the illness. And as I said, some of the good news is California was one of the early states to enact this isolation and distancing, and we are seeing flattening of the curve and even improvement now in our overall numbers. When these stricter practices of taking temperatures when people leave homes, and the distancing, and really shutting down of local areas and workplaces, this is what was done in China. And so this graph is showing you early on what was seen in China, and what they saw in following new recoveries. That's the green bar or green line there, compared to the new cases that were occurring. Basically, in the middle of February, China was able to see more new recoveries than new cases. So they really started to turn the curve, and you can see how new recoveries continue to increase and has stayed above the new cases. So this is what we're hoping we're able to achieve here. Certainly beginning to see parts of America that are showing this, but still lots of work to be done, and we're not ready to come off of these isolation or distancing recommendations just yet. But the good news is we're seeing some traction. There are other promising developments, so a lot of work being done on treatment modalities. There are numerous phase 3 trials going on in the United States. One early drug in China was a Japanese drug called favipiravir that was shown to help reverse the early lung damage, as well as shortening the overall duration of the COVID-19 illness that's caused by the coronavirus. So we are very hopeful that more treatment regimen and combinations will come out. But we're also seeing and asking that people understand that those treatments need to be reserved for patients who are the sickest, so patients who are on the inpatient. So please do not be surprised if you find that your doctor or your pharmacy is going to ration your medications to prevent hoarding of medications, because they want to make sure that they reserve enough for the patients who are going to get sicker and require inpatient hospitalization. But there's really some promising developments here on the treatment side, and so we'll continue to follow those and keep you all informed as they develop. We wanted people to understand just what to expect across an entire population, and this is based on a study done in China early on in the infection and the spread of the illness, where 44,000 patients were followed. And again, this is on a different group of people in a different part of the world, where they saw a mortality rate of about 2.3% across all cases. Actually, we believe, and I think the projections may show, that we might expect an overall lower fatality rate from COVID-19 once all is said and done and all of the asymptomatic or lower symptomatic people are tested and discovered. But what we expect to see, and what they saw on this study that was done in China, was that about 5% of patients have severe cases. Those are patients who do require intensive care unit admission or ventilator support. So really the highest level of illness that we expect from this. Then another group of people, that 14% of critical cases, are the people who are just require hospitalization. So most people are not going to require that hospitalization. So if you look at that next bar down, 81% of cases will be mild. So this is really where most identified confirmed cases will fit. People may have severe symptoms, they may even have some breathing problems, they get tested, and it turns out that they actually never require hospitalization. And then the largest group will probably be an unidentified, undiagnosed group that we are never even aware of the full size of that group. So that denominator of the total people who are impacted or affected by COVID-19, many of them will be asymptomatic, may have 1 to 2 days of symptoms, and so they'll never even get tested or qualify for testing. And so we will not know that those people even had this infection. But the good news there for all of us is that we don't need to rush or fixate on the need to get tested if we have very mild symptoms, because most of us will have 1 to 2 days of symptoms and recover very quickly. We've been talking a bit about your risk, and so I think people have had opportunity to get educated about this, but it is important that you understand that even when people say people age 65 and up are at higher risk, that is true, but it's also important to understand that your risk is also could be elevated even below 65. And so the point of this is just to say those vulnerable populations are general guidelines and rules, but but they're along a spectrum. So if you're 60 years of age, if you're 80 years of age, all the way up to 100, as you move into more senior years, you are going to be higher risk of mortality and more severe illness as you move along that age spectrum. The same goes for if you have a chronic medical condition. 60% of the population may have one chronic condition. 40% of the population might have two chronic conditions. And so it's very possible that you are someone who has diabetes or heart disease, or maybe you're a cancer survivor. And so therefore, if you fit into those populations and then you add elevated age to that, your risk does go up. So these are not just single indicators of risk, but really they are cumulative. And as you add that risk together, your risk goes up. So very important to recognize that and to take this all very seriously. The other group of chronic ill patients who do have risk are those patients who maybe have a chronic illness like rheumatoid arthritis or lupus and are on treatment medication for that illness that affects their immune system. And so those are also people who may be part of a vulnerable population. To help people understand this as well, their individual risk, we created a free risk assessment on our platform. And there are many of these tools now that are out there. And we wanted people to be able to understand their individual risk and to understand and identify themselves as either mild, and maybe that means they're appropriate for self-management in their home, or there could be moderate risk. And so those are people who maybe they're appropriate for a telemedicine visit. And certainly that's part of what our platform does, is it allows those people to connect to a doctor very quickly and easily. And then there might be more severe patients. So those patients who have more severe illness might be appropriate for inpatient hospitalization or assessment. On the testing side, a great deal of talk has gone out about the testing and the need and to have this done. As we move deeper into this illness, we know that those testing resources, because they are limited, really should be reserved for a few groups of patients. First, it was reserved for patients who are inpatient or admitted to the hospital. Second, healthcare workers who develop symptoms. We need to know if they have COVID-19 so that we can isolate them from patients and they're not spreading this illness from vulnerable patient to vulnerable patient that's already in the hospital. And then thirdly, patients who are part of those vulnerable patient populations on the far left end of the slide, those patients, if they develop symptoms, they should have testing, because we need to understand and be able to predict what their risk of more severe illness may be. Once we get beyond those groups, patients with symptoms that start to get on the more severe range of the spectrum also should be tested, but those people will only be tested and will only qualify based on the severity of their symptoms, the doctor's individual recommendation, but also the available resources in their community. So that is something that we need to trust our healthcare professionals to help allocate those resources in the best way based on the situation that's local to you. When it comes to returning to work, I think antibody testing, serology testing is going to be very useful here. This IgM and IgG antibody is helpful. If you have IgG positive and you're IgM negative, then that means you'll have immunity, and that might mean that you're able to re-enter the general population and you're not at risk of spreading this infection to other people. What we ask our doctors to do, we have attempted to make this more straightforward and simple, and want you to understand how they're going to make decisions. And so we're really asking them to answer 4 basic questions. One, they're doing a video evaluation. Do they see and observe symptoms or feel that the history is severe enough that this patient requires inpatient assessment or in-person treatment or hospitalization? Second, it is still the end of flu season, although again, flu season's almost done. But could this patient have influenza-like illness? Would they benefit from treatment for flu with an antiviral treatment? So that's the second question. The next question, the third question is this patient appropriate for testing, and are there available resources for that testing in their area? And then also, does that testing result warrant public health officer reporting? And so again, for obvious reasons, the spread of this illness has to be tracked. And so that's a very important question and really important decision to make, is whether someone qualifies for testing. And we certainly hope more resources for that become available soon. And then finally, if the patient is COVID positive, how long do they need isolation for? or if they are presumed positive but never tested, how long do they need isolation for? And eventually we'll be answering that question of, and when can they return to work, or when can they return to the general population and normal functioning? And so that's something that's going to become more and more important as we get on the other side of this illness. The final thing I think we wanted to go over with you is what can you do? So this is a very novel and unique situation, you guys. I called it unprecedented in the beginning, and there is some precedence for pandemics, but we don't see these until, these are like every 100-year types of events. And so this is a big deal. It's important to pay attention to. And why is it so unique? One, we don't have a vaccine for this illness. We do not have a proven antiviral treatment for this illness. And as a population, we don't have any existing immunity for this illness. So we are developing that immunity in parts of the population now, but as you all know, that is not without cost. We have now, I believe we've now surpassed 14,000 deaths in the United States alone from this illness. And so there's a cost to this on a public health and population scale. And so we want to give you all some pointers on really how do you address this type of situation. And one of the things you can do in the public health approach is what we're doing on a wide scale now. Almost, I think, 9 out of 10 Americans, I think, is being asked to telecommute or work from home. We're all being asked to perform some sort of social distancing practice. If you are sick and have symptoms, you can self-isolate within your home, and then you can connect to doctors remotely through virtual care or telemedicine so that you can get guidance on how long to maintain that isolation. And obviously travel restrictions and so on. So there's an important public health aspect to the approach. There's also a self-care management piece, and I think this is becoming something I'm hitting on more and more now as we get deeper and deeper into really what I think is more like a marathon than a sprint in terms of what we can do in response to COVID-19 infection. Is recognize that we're social people, and it's not normal for us to isolate and be in our homes and do the same Groundhog Day routine for weeks on end. And so that is likely to have some impact on your mental health. And so I think it's very important for people to develop strategies, whether that's performing a routine, identifying the things in their day that they can control so that they can deal with some of the anxiety around the uncertainty, making sure you get your sleep and you have regular meals, and you wipe down surfaces. There's a great deal of self-care tasks and practices that you can engage in, and so we would advise that you do those. If you find yourself, if that's not making you feel better, and you may be more than subclinically depressed or anxious, and you just can't control those emotions, then we certainly would recommend that you connect with a behavioral health professional. We do have capacity within our behavioral health practice, and we would encourage you to connect to a behavioral health professional through telemedicine if you're having a hard time controlling your emotional symptoms on your own. And then finally, there's symptom treatment that's on more of the physical side. So do you have fever or pain? You can use Tylenol, and or acetaminophen. And we would recommend that you use that rather than ibuprofen, especially if you do suspect that you are COVID-19 positive. There seems to be some correlation with ibuprofen use and lung injury, or at least we felt that was the case early in this illness. And so there's some advice to avoid the use of ibuprofen, naproxen, Advil are all similar medications. But acetaminophen seems to be effective and not have any reaction with the lung. Also, your regular medications are something that it's important for you to keep up on, make sure that they're not expired. And then also you can use some kind of home remedies. Warm liquids can help soothe the sore throat. Also, humidifiers can do two things. One, it can keep the throat from getting dry and sore, but also that moisture in the air can attach to respiratory droplets. So if you do have a sick individual in your household, that humidity may actually bind to the respiratory droplets and actually bring them down to the ground sooner, so you can get them out of the circulating air. So those are just some guidance that we would have around management of this condition, both from a public health standpoint as well as symptom treatment. We'll go ahead and go to the next slide, and I think at this point I'll hand things back to Bill, and we'll handle some of your questions.
Great, thank you, Dr. Tong. And we did get a bunch of great questions here. If anybody does have a question, feel free to use the feature in the webinar control panel. Earlier you were talking about hypertension and diabetes being indicators of being at risk. Would you consider obesity in that category?
Yes, the so part of the reason why diabetes is on there or immunosuppressed drugs, there is some evidence that as we become, if someone is morbidly obese or has a higher BMI, they do increase the risk of their body's response to infection because there are parts of the immune system that don't work as efficiently as we would like. So that is a risk. However, it's not been identified though as a higher much higher risk. So I would be much more concerned about diabetes, or heart disease actually seems to be like the most correlated chronic illness with COVID-19, higher severity of COVID-19 infection. So heart disease was the most common thing seen amongst the patients who suffered fatality or more complicated and severe symptoms on the inpatient side in China. And I think that's really stayed consistent as the illness has spread to other countries. So I would just say I would be more careful if I had a higher BMI or body mass index, but it's just kind of more common sense on in relation to your body's ability to fight off infection. But the studies have not yet shown that there's a great deal of increased risk there.
Okay. Well, when you were mentioning conjunctivitis, which is a newer symptom or one that just recently come out, should I be concerned if my children have pink eye?
It's a great question. If they don't have other symptoms and all they have is pink eye, I would not be terribly concerned because you can get pink eye with other coronaviruses. So even if it meant that they in this instance, you might assume that they've been exposed and could have coronavirus. I wouldn't be terribly concerned because again, this infection is actually not known to be as severe or have as negative an health impact on children. So our kids are not as at high risk, even if they do get COVID-19 infection. But I would use that as an indicator of, well, maybe I need though to have my child not be exposed to their grandparents while they have that infection, because they could feel otherwise asymptomatic other than that pink eye and then still pass the infection to a vulnerable grandparent. And so that's the way I would treat that situation.
Okay, great. Is there any idea if the virus has mutated and if there is a new strain out there? Do we have enough data around that?
It's a great question, and I think the reason why there's so much talk about that is because people who study the epidemiology and biology of these viruses know that that's a high likelihood or risk, especially if something's around for a long time. It absolutely can undergo mutation, and so there could easily be two or multiple strains. The question though is, are those strains different enough that that one of the strains becomes novel even from this novel virus, right? So they usually, the mutation in many cases is close enough to the original virus that it's not fully, it may be a different strain technically, but it acts almost identical to the active infection that we're experiencing now. So right now, I would say there's not enough evidence to suggest that there's a different, an illness that's behaving differently, that we should think about it differently from a clinical standpoint. We would treat it the same, react the same, and communicate the same type of risk and symptoms to patients based on what we're seeing right now.
If I have symptoms that are mentioned on the 2-symptom list, but it seems like I don't have shortness of breath, would you recommend that I self-isolate and treat at home, or does it make sense for me to try to get treated or tested, or go to the hospital?
Yeah, no, I love that this type of question, Bill, because it's someone that it's showing that they're understanding the guidance, and so it's true that there are more concerning. So not all the symptoms are equal. That's first. If you have a high fever over 101.3 and you have shortness of breath, that may suggest higher risk than if you just have sore throat and some cough and a lower grade temperature like 99.7 or something like that. So So it is a good call out, and I would recommend if you do the risk assessment that we've got on our site, or would like to speak to a doctor to help you determine your individual risk. I think that's a great way to handle this type of question. But in most cases, you're probably going to be fine to stay home and avoid the hospital, because as we all know, there's many other types of infections one can get just from getting into a hospital. So I think this patient sounds like that with these types of symptoms could stay at home, self-manage, and then talk to a doctor remotely just to make sure that they feel confident that they're doing the right thing.
Great. You were talking about some of the medications you could take. What about something that might suppress your cough or help you to relieve your cough, like Mucinex?
Yeah, that would be so. It's definitely fine to use cough suppressants. There's actually prescription medication as well, something called Tessalon pearls or benzonatate, that can help to sort of numb the nerves that are irritated by cough, and when infections get down into the bronchial airways, or what we call the bronchial tree. And so it's certainly a reasonable thing to do, and I would encourage you to use symptom relief. Sometimes just warm liquids are also effective, but I would say, yeah, no, it's fine to use cough suppressants or other types of medications that help to thin the mucus of the cough. The good news here in this illness is it's really not much sputum production. So I think some of those, so not all over-the-counter medications are equal. So I think this could be a scenario where a prescription cough suppressant like benzonatate might make the most sense.
Okay. If do you think it's reasonable to disinfect all the surfaces in a home, even if nobody's left the home for 2 weeks, and disinfect them basically every day, do a daily clean?
Yeah, that's a really good kind of practical question. It's like, how much risk is there? Many people, if you're like my family, we get things delivered, and so Amazon workers, God bless them, and others are still, the U.S. Postal Service, they're still delivering things to our home, and so it's low likelihood. I think this is where a combination of wiping down surfaces and washing hands are very complementary. Something new comes in, if you open it, get rid of the external packaging and then wash your hands and only handle the internal packaging or contents with your clean hands, very low likelihood that you're bringing in new infection into your home. The only risk there would be if a member of your home is leaving the home daily, like my wife, who works in a hospital as a physician executive. I definitely am going to be wiping down my surfaces daily because I know that there's potential for her to be asymptomatic in the home, but also spreading respiratory droplets. So those are just some of the risks. But if you don't have a healthcare worker in your home and people aren't going out much, I think your risk is very low. So a once a day wiping down the surfaces is great, but absolutely the risk has gone way down if you've been home for 2 weeks, no one has had symptoms, and no one's been outside the house.
Okay. Maybe you can give some guidance around wearing a mask, especially if you're going outside just for a walk or a run or something like that. And should we be wearing a mask every time we leave the house, or just if we think we're going to be in a store or in contact with other people?
This is a good, yeah. I mean, this is one where it will depend on where you are in the country regionally and what the prevalence of COVID-19 spread is in your community. So we've had plenty of it here in California. The governor has said we want people to wear masks now. I think that's good advice given once you get to a certain point. And I think it might seem counterintuitive because California is actually seem to be turning the curve and potentially flattening the curve and getting better. But I think there's also, even though you're having fewer infections now, there is the possibility of a secondary surge here because people let down their guard. And so I think this is a little bit, maybe it's a little bit, I don't think it's overly conservative. I actually think it makes sense to me that once a certain number of people have the infection and are shedding virus in your community, it does make sense to ramp up your efforts. And so I think that's what they're doing. Even though we are seeing a slowing of the spread of the infection in California, again, it's not counterintuitive to me to take this next step because there are enough people that have it that you run the risk of a secondary surge. So it's kind of like belts and suspenders at this point to make sure you don't see a reversal of that flattening of the curve.
Okay. If I have mild symptoms, how long do you think before I should return to work?
Okay, yeah, there's some good guidance from the CDC on this. If someone develops symptoms and they're not confirmed positive COVID-19 infection, then that individual should mark the beginning of their illness. This is a very important thing. What day did your symptoms start? And you should be honest with yourself about what that day was, and then and you can talk to any healthcare worker that can help you determine this if you're not sure on when your symptoms actually began. But 7 days from the onset of your symptoms, if for the last 3 days of that 7 you have not had fever and you haven't masked that fever with a acetaminophen, then the CDC is saying you are okay to return to the general population, because the reality is, there's what we've learned about this illness is that you're unlikely to be shedding virus for much longer after that 7 days. Now, certainly, if you're someone who still has symptoms and maybe you're still having cough or sneezing, and that gets to the 7th day, then maybe I would recommend you extend to 10 days. But that's a decision that I think, again, that's why it's good to talk to a healthcare professional just to be sure, and then be able to end your isolation.
If I had the test for COVID-19, I'm awaiting the results. I've noticed that my pulse is a little bit higher than normal, or a little bit more rapid. Is that something that I should be concerned about?
Yeah, it's a good, I think if you want to be conservative, any physiologic change, so where the body's compensating for something, it should be taken seriously. So whether that means, again, I used a high fever over 1013 as one example. Speeding up of your respiratory rate would be another. But also in this example, an elevated heart rate above 100. If your heart rate remains below 100 beats per minute, that's usually still considered normal. And so I wouldn't be overly alarmed there. And I might just ask myself, am I keeping up with liquids? I probably, have I been having more fevers and sweats? If so, that you just need to make sure you're drinking lots of liquids. That's why we give people that advice so often when they have illness, because you tend to fall behind on those, and you don't realize if you're congested and you're breathing through your mouth, you don't realize that you're losing moisture and water, body water loss that way just by breathing. And so anyway, those are what I would say is, trying to stay hydrated is important. If you find that your heart rate is above 100 for a sustained period of time, then absolutely, I would say you should get a doctor visit, do a virtual doctor visit, and let that doctor do a little bit more of an evaluation to see if they can help determine what's going on.
Any idea if nebulizers are being used to treat COVID-19?
There was, I think there was some concern about this, not for otherwise healthy individuals. The answer is no. And there's no, I don't think there's been shown to have any major therapeutic benefit in an otherwise healthy population. Now, if I had asthma or COPD, then absolutely, those are patients who should have their inhaled steroid, and then also should have maybe a beta agonist like albuterol or something that is not expired. Make sure that their medications are not expired, because if you're going to need those, if you have asthma or COPD or some other lung disorder and you were prescribed an inhaler in the past, you got to make sure that it's active and the active ingredients are still good, so that they will be effective if you need them. But no, there's not been an independent, review and demonstration of benefit of inhalers in an otherwise healthy population.
Okay. So where would abdominal pain and diarrhea, those are the only symptoms, fall in the category? Would you say that that's possibility for COVID-19, or do you think that's probably not?
It's a possibility. Less than 20% of patients are going to have diarrhea as one of their symptoms, but it's certainly in there, but it makes it a little bit less likely if that's the only symptom that you have. And so it sounds like that was the question in this case, is like, I only have really GI type symptoms. So certainly possible, but usually those symptoms are very self-limited and run their way out very quickly, and they do not, no pun intended, and they end up resolving. And so just more important to keep up with liquids there, and then and probably less likelihood or risk of spread of that type of infection, um, as long as people are practicing good hygiene and washing hands and so on. So, but it is possible, and so I would probably isolate in the house if I'm sharing that, and maybe even having a dedicated bathroom and that gets wiped down daily is important.
So we're in a time where there's a lot of anxiety and stress. Do you think that could lead to people becoming more at risk to getting coronavirus?
Well, I mean, it's I would say this is one where I think we're all affected, I'll be honest. And I think it's very normal, myself included, to have a bit of anxiety. And I feel like I have a decent knowledge base about, this. And I've been around a lot of sick people in my life through my profession. And I typically don't get, that anxious. But the infodemic of this illness has been, I think it's just very natural to feel a little bit of anxiety because of that. It doesn't necessarily put you at increased risk. However, high degrees of stress we believe that they do have an impact on the immune system. And so in any case, the stress uh, can be unhealthy. And so a normal amount of anxiety of being, hey, I'm a little afraid of this illness because it's all over the news, and I'm worried about getting sick, and I really don't want to get this. That's very natural. I mean, you're not normal if you don't feel a little bit of that. The good news is that might be the healthy amount of anxiety to have, so that you are careful and protect yourself and protect your family. The inability to control that anxiety, where it starts to cause stress and repetitive behaviors that maybe seem irrational, that's when it starts to become a little bit concerning. So if you can't sleep because you can't quiet your mind around the concerns of COVID-19, then you might be, then yes, you could be causing enough, or experiencing enough stress. You're not causing it, but you're experiencing enough of it that could decrease your immune system's function and put yourself at a little bit more risk of infection. So again, but good hygiene and strict enforcement of social distancing can do a great deal to give you control over prevention of this illness. And so I would just advise taking those types of precautions.
Okay. Another question that we have here is about doctor's notes. My employer is looking for a doctor's note before I return to work. How can I get one?
Yeah, I think, there's actually guidance on the HHS, Department of Health and Human Services website. Your employer really shouldn't be asking for that in the middle of a global pandemic. That I would ask that you maybe push back a little bit on your employer and say, look, maybe go to the HHS website and show them where it says that that's not something that they should have to do. There's guidance from the CDC and HHS on with symptoms that if your symptoms have resolved, as I said, after 7 days, and the last 3 days of that you didn't have a fever, you're very low likelihood of spreading that illness to any other people, and you're not shedding virus. And so it's just, they're really putting inappropriate burden on our limited healthcare resources in this country to ask you to do that. So I would just ask them to not do that. But if they have to, please do a visit, and we'll help you figure out when is the proper return to work protocol based on your situation.
Okay. And a couple questions came in. You talked about this earlier regarding leaving the house and whether, sanitize the surfaces daily. What is the best way to handle groceries coming into the house, whether they're being delivered or whether, we're actually going out to get them?
Yeah, this is where I was talking about the packaging. I mean, I have seen videos of people wiping everything down. I think if you've got a vulnerable member of your family in your household, it's reasonable to take the extra precautions. Um, I know that there's also training of the food delivery companies. People do have this training also to minimize the risk of spread and exposure. So I think it's certainly reasonable to wear gloves, and again, handle the external packaging with the gloves on if you'd like, or if you don't have gloves, you unwrap and then remove the contents and then wash your hands. Those are the ways that I would approach this. In the grocery store, it's a little more difficult to do, but I believe they are, when I go, if I bring my own bags, they require me to pack my groceries myself, so that reduces the risk. And then very religious washing of hands and good hygiene is the other defense mechanism that you have there. And just in case anything has been missed, just continuing to wash your hands and avoid bringing your hands to your eyes, nose, or mouth unnecessarily between hand washings is going to be protective.
Great. Thank you. So that brings us up to our time. Dr. Tong, any last comments?
I think I'm hoping that this is helping people with addressing some of the anxiety and answering their questions. We all have things we can do during this illness to protect the parts of our population that are vulnerable. So that's why we're taking this seriously. And I certainly don't want to preach to the choir. I think that's, I thank all of you who did tune in because you care about this. You are taking it seriously. So I thank you for that. And please do spread some of this information to your colleagues and family members so that we can get on the other side of this quickly. We will come through this illness. I have no doubt. But I just think it's going to be it requires a nationwide effort to do so efficiently. It won't work if one part of the country is doing one thing and another part of the country is doing another. And if everyone's just doing their own thing, we won't get there as quickly as we would like. So anyway, so I appreciate everybody's efforts. And yeah, and please, if you do have the need to speak to a clinician, know that we are here to help you. And but I'm confident we'll come out on the other side of this okay.
Great. Thank you, Dr. Tong, for taking the time to talk to us today. And thank you, everyone, for listening. You will receive a short survey after this webinar. If you could take a minute to complete it, that would be great. You can also, if you want to take the COVID risk self-assessment, you can go to drondemand.com and you'll see a banner for that. And you can go through the questions there. There might be 11 or 12 questions that you can answer. Give yourself an idea of what's happening in your life. And with that, we are here if you need anything. So feel free to reach out to us at Doctor on Demand. Thank you, everyone, for joining us. Take care.